Hello, hello, and welcome to When Docs Talk. We are so excited to have you here today. My name is Dr. Aditi Young Ipe Akpo, and we are When Docs Talk. Not when, just one when. In any case, I want to thank all of you who are joining us tonight for the first time. For those of you who have been asking, when are you all coming back? Because it has been a little bit of a hiatus. I just want to let you all know that it has been it's been a tough couple of months for some of us because life, because COVID, and just because of other things. And we also wanted to take time to regroup over the summer and really just kind of assess how things were going in the world. But we're back. School's in session for everybody in the nation. Most of our kids, those who have them, are back in school. And so we have joined, we are back in session too. So welcome. When Docs Talk, who are we? We are a collaborative of emergency practitioners and providers, including nurses. We're based here in Atlanta, but we actually have members who hail from all across the United States and the world. And we really are here to give perspectives on subject matters that you often don't hear from people in the medical field. We definitely like to talk about medicine, but we like to go beyond that and talk about the things in medicine or the things in this world that others don't really touch. So we're going to do that a little bit today. I want to just remind you, if you're joining us for the first time, that we'd love for you to go ahead and like, share, and subscribe. We're on YouTube, Facebook, and Instagram. So definitely join us and let us know who you are. Give us your information and we'll give you notifications. I want to bring in the rest of the crew because we have an awesome crew that wants to meet you and wants you to meet them. Hey, ladies.
Hey.
How's it going?
Good. How are you?
Awesome. Do you want to introduce yourselves to our audience?
Hey, my name is Morgan. I hail from Brooklyn, New York. I am a registered nurse, and I am so looking forward to this program. I think it's needed. I think it's long time coming.
I am Sonia Pinson. I'm a physician, family practice trained. I'm working in an urgent care and ER setting, but I hail from Georgia and also a Navy veteran. Once again, I'm glad to be here this evening and glad to have all of our fine guests that we have tonight. I'm looking forward to our discussion.
Oh, yes.
Hey guys, I'm Dr. Yu Lee. I am a family medicine physician, also working in an urgent care emergency setting. I am from New Orleans by way of Arkansas, and I am really happy to have this conversation this evening.
Hi, I'm Vita. I am from Memphis, Tennessee. I'm a registered nurse. Travel registered nurse, we do it different. But I'm very excited about what we're going to be discussing today, and along with the different perspectives that a lot of the guests are going to be bringing. So,
All right. Well, that's our crew. We have others who sometimes join us, but basically you'll always hear from people who are working on the front lines, people who are emergency doctors, nurses, sometimes PAs and NPs. I want to just talk a little bit about COVID, because as you know, we all kind of started this broadcast just about a year ago when COVID started. And we want to always keep you with your hands on the pulse of the disease and what's going on from the front lines. For those of you who don't know me or haven't joined us before, I'm Aditi Young Ipe Akpo. I am an emergency physician, also trained in internal medicine, and I've worked in emergency settings for over 10 years, level 1 trauma centers, all the way down to freestanding emergency departments. And so I hope that I'm able to bring that perspective. I am a proud wife and mother of 3. And I'm going to talk to you a little bit about my 3, because when we talk about schools and what's going on now, my perspective will come strictly as mom and a little bit of Dr. Mom. In any case, let's tell them a little bit about what's going on with COVID, ladies.
all right. So, as of today, roughly 290 million cases worldwide of COVID have been reported and over 4.5 million deaths. Over 41 million cases in the United States and over 670,000 deaths.
So we always report those numbers as they go up. One thing we noted is one of this new statistics.
1 in 500 Americans have died of COVID. 1 in 500 Americans. Wow. 72% of adults know someone who has died or who has been hospitalized or died from COVID-19.
So this is something that at this point, nobody can claim, I don't know anything about COVID. You know somebody who knows somebody who has been impacted by this disease, as the statistics show.
So the vaccination rate in the United States, it's kind of interesting to look at. So at least 63% of all of us, all Americans who are eligible to get the vaccine, 12 and up, have gotten at least one dose, and 54% are now fully vaccinated. If you break it down by ages, 12 and up, we're looking at 74% getting one dose, 64% becoming fully vaccinated. 18 and up, 76% have gotten one dose, but then that drops back down to 65% getting both doses. Meanwhile, y'all grandmas and grandpas, they're not playing. They out here getting vaccinated. 93% have gotten one dose, 83% are fully vaccinated. Papa ain't playing.
So yes, a large number of our older adults have been vaccinated, and we still have a ways to go. As a country, we're behind a lot of the other industrialized nations with our vaccination rates. We're just a little over 50%, as Yolanda just shared with us. But we're going to delve into some other statistics, because now that it's now leaving the medical community and really permeating into our culture, there are lots of things that examine how we're dealing with it. How are we dealing with COVID? What do we think about it? What do we think about the restrictions? What do we think about how it's changed our lives? And that's really what we're going to be talking about. So we wanted to share this with you.
So this is an Axios survey in which they polled parents on what and parents of school-age children and what their thoughts were on mandates in school. So actually, 59% of the parents did poll and say yes, that they do support a mask mandate versus the 30% that have said no. So kind of, interesting from the standpoint of, as we've all seen on the news and multiple places where it's kind of playing out, the debate on mask mandates in school.
Absolutely. It is interesting. And what's also notable, so this was from an Axios poll, which looked at people throughout the nation. So across the nation, it was about just under 40,000 parents who had school-age children, typically school-age children who were at least above the age of 5, although they did include some that were a bit younger, and definitely under college age. So this was really for school-age children. And in that same poll, they showed us some other statistics. So it's no surprise that we are very divided as a nation when it comes to how we should be dealing with COVID-19. And so we're going to talk a lot about those divisions, but I want you to know in that same poll of almost 40,000 parents that there were some divisions just based on gender and race and politics. And I just want to share some of those with you. So in that same poll, when asked about whether they support a mask mandate or a mask requirement, as some like to term it, 66% of moms said they did versus 50% of dads. So moms are definitely on board as a whole with wanting to make sure that the kids wear masks if they see it as protective. When they looked at that same poll and asked about support for a mask mandate, you can see that the vast majority of Democrats supported it, quite a big majority of independents, and very few Republicans. So that's one divide that we're already seeing emerging. And then when we look at it by ethnicity or race, you can see more divide coming, unfortunately. It seems that in that poll, 94% of Black parents supported a mandate, 85% of Hispanic parents, 75% of those who classified themselves as other supported it, and about 58% of white parents were in support of a mask mandate. Now, I sometimes, talk with my colleagues at work, and we talk about things, mask mandates, vaccines, things like that. And, I feel like a lot of us are pretty much of the same accord, but I wanted to reach out to some emergency doctors in a social group that I'm on Facebook, and just get us an idea as to what were their thoughts as emergency doctors, who are by and large on the front line. do they think that we should be masking our kids in school? And so on that poll, we saw that 93% of the respondents definitely supported a mask requirement for indoor students in K through 12 schools, regardless of vaccination status. 6% said no, so only 6%. And then 1% said, you know what? It depends on whether the people that were in question are vaccinated or not. So there's a lot of opinions going on about vaccines, masks, and everything. We just talked about masks now. And surrounded and embedded in those opinions are a lot of passion and a little bit of craziness. I want to share some headlines with you, our viewers, and also our WDT host. Some of you might have heard this, heard some of these, but if you haven't, I really need you to know where we are as a nation and how we're thinking about this. So these are some headlines pulled from the news. Student mocked at school board meeting after sharing that his grandmother died of COVID-19. I watched this myself. The student was talking about why he is supporting a mask mandate and hoping that the adults would. And he mentioned his grandmother dying, and he was mocked. There's questions as to whether he was booed and maybe even told to shut up. In Arizona, a principal, a woman you can see there, was confronted with zip ties when she asked that a student quarantine after exposure to COVID-19. She had to actually call the police because she was scared for her life. Meanwhile, in the friendly skies, a couple was kicked off JetBlue because they refused to wear masks, were berating the staff, and so it was a whole big mess. And then the most, I don't want to say sensational, actually depressing of all of the news stories happened here in our backyard in Atlanta. A man actually killed a woman in a grocery store. She worked at the grocery store and asked him to put on a mask, which was required in the store, and she was shot dead for that. So we are clearly somehow not just divided, but losing it a little bit in terms of our passion, and people are getting hurt. And we're not just talking about feelings here. We're talking about lives lost in some cases and bodily harm threatened, fistfights breaking out at parent school board meetings. I want to show you one other thing, and then I want my crew to weigh in before we bring in some of our expert guests that are joining us today, because I found this particularly, well, I don't want to bias you. Just watch it and you tell me what you think.
All right.
That's a, excuse me?
Excuse me, I'm coming through. You're so cute.
She's coughing at me. She's coughing at me.
No,
yes.
look at you guys. You're so cute.
You're such a Karen.
Okay, whatever. You're such sheep.
Why don't you have a mask on?
Because I don't need to have one on. I'm not sick, and neither are you.
Okay, but you don't have to be coughing at me.
You don't know who's sick or not.
Can you put
It's my allergies.
You
I
don't
have
know
allergies.
who's sick or not by looking
Oh,
at somebody.
yeah. And so 2 years ago, before anybody started talking about COVID, you were okay with that, though, going out not knowing you were sick, right?
You don't know anything
Right?
about my health.
I don't.
Yeah, she's coughing at me.
I have my allergies, and she got all freaked out because I'm coughing.
No, she's coughing.
How do you know? You don't know, and she just said I don't know anything about her health.
We don't know
You don't know anything about my health. Maybe I have a medical
Okay, everybody.
release. I don't need to wear a mask.
Okay, bye.
Post it for you. How about that? Good. I think I'll get real close to you and cough on you then. How's that?
Oh,
Asshole.
wow. No. No way.
Let's go.
Wow.
Mm-hmm.
Wow.
What's going on? I felt like if I just described it, you wouldn't believe it, because I wouldn't believe it. I would not believe that this is happening in this country over this issue. So I wanted you to see what it looks like in real time.
I just have one question. I have one question.
Please.
I'm just trying to figure out why people are so aggressive. I mean, why do they take it so personal? I mean, I don't understand. I mean, that's actually assault.
Well, actually, funny that you say that, because the first woman she lost her job over it.
Okay.
Because of course she said it wasn't intentional, although in my opinion she was she was laughing and she thought it was cute. It was obviously intentional. The second woman was arrested. So you're right, Morgan, it was considered assault. Other thoughts?
I just looked up how many years I'd get for slapping somebody in the face who did that. About 3 to 5 years, but I got babies, so
and I have a license to protect, so I have to think about that every time I encounter someone like that.
Self-defense. I felt like my life was threatened. She invaded my personal space.
There
And I
it
didn't know what it would have escalated to, so I had to protect myself.
There it is.
Yeah, I just don't understand the level of anger, because it's one thing to say I don't want to wear a mask, but then when you infringe upon somebody else's space, and especially when they're talking about their rights, well, why are you infringing upon somebody else and their right to do what they want to do?
I just want to say yes. I just want to say yes to Grace. Grace is making a comment, and yes, I agree with you. That is assault.
Yes,
absolutely.
And the law agrees with you, Grace. That is assault because she was arrested. So we have opinions on it. We all have opinions, but we need to understand that there are many diverse opinions. Certainly, I think even people who are not in support of a mask mandate would probably not be in support of that sort of behavior, although some would. Maybe the people who want to zip tie people, but it's getting out of control. It's getting out of control. And you asked a great question, Sonia. What is all the anger about? Where is it coming from? And so I think that's one of the things that we're hoping some of our other guests will be able to let us know and make us understand. Because from our standpoint, we're in the hospital. And we know for years, we've been wearing masks. We know they work to prevent respiratory droplets. And so we're like, oh, it's kind of a no-brainer for us, for most of us medical people, that, oh, there's a disease that is carried in respiratory droplets. And so let's do the mask and the vaccine, which we're definitely going to have to talk about. But it's not black and white for a lot of people. So at that note, I want to bring in some of our expert guests today. We are so fortunate to be joined by other people who will be commenting on what's going on from a medical perspective as experts. Okay, Rebecca Williams, I definitely agree it's ridiculous what happened. But in any case, let's bring on our first guest, Dr. Xanthia Wiley. Dr. Xanthia Wiley, we're actually fortunate to be joined by, again, she's joining When Docs Talk. She was with us on our show about the COVID-19 vaccine, where she gave us so many good insights on what's going on. Let me tell you a little bit about her. She is an associate professor in the Division of Infectious Diseases at Emory. She's the director of the Antimicrobial Stewardship at Emory Midtown Hospital and co-chair of the Emory COVID Treatment Guidance Committee. As an infectious disease specialist, she is keenly interested in continuing the conversation about the importance of COVID-19 vaccine and masks. We are so delighted to have her. Welcome, Dr. Wiley.
Thank you so much for having me again.
Yes. I'd like to bring on our next guest, Dr. Keisha Frazier-Doe. Dr. Frazier, as she goes by, is an assistant professor of pediatrics at Emory University and a pediatric emergency medicine physician at Children's Healthcare of Atlanta, an academic physician with specific interest in pediatric firearm injury research, and a wife who combated COVID-19 vaccine misinformation from her spouse and convinced him to become vaccinated. She's also a mother of 2 children, one vaccinated and one unvaccinated just because of eligibility, being too young, essentially. She's also a human being with an interest in public health for all, and we are so fortunate to have her with us today. Welcome, Dr. Frazier.
Welcome.
Hello, hi everybody. So glad to be with you.
And I'd like to bring on our last expert for the day, and that is also a return guest to When Docs Talk. Once again, she was on our vaccine series giving us guidance, Dr. Megan Kirksey. Dr. Megan Kirksey received her PhD from the Rockefeller University Microbiology and Immunology and her MD from Weill Medical College of Cornell University. She joined Hospital for Special Surgery after completing specialty training in anesthesiology at Cornell and fellowship training in critical care medicine at Columbia University Medical Center. She's been actively involved in care of critical COVID patients and education related to COVID complications, treatments, and vaccine. Thank you so much for joining us, Dr. Megan Kirksey.
It's great to be back. Thank you.
All right. So before we bring on our next set of guests, I'd like to just cut to commercial from one of our sponsors, and we'll see you after the break. Okay, that is Skinworks Day Spa in Covington, Georgia. Check them out at skinworksdayspa.com. All right, we'd like to bring on our next set of guests, and I will have our hosts introduce them because some of our hosts, for instance, Yolanda, know them personally. We'll start off with our first guest.
Miss Crystal Alptaken. I have known Crystal for many years before Dr. Yulee was Dr. Yulee and I was just Yo-Yo. She joins us from Texas, where she is a married mother of 3 in a military family. She is going to share her perspective on the COVID-19 mask mandate as well as the vaccine debate. And I'm so happy to have Crystal here with us today.
Hi, Crystal.
Hello. Hi.
Hey, how are you doing?
I'm good. So for the vaccine, I believe it should be choice. At the end of the day, like, you're responsible for your own choices. So if somebody picks, I'm going to take the vaccine, or if I'm not, something happens, they have to answer to their own selves.
Fair enough. I'm going to bring on our other guests and then we can get into our discussion, okay?
Okay.
All right. Welcome to the show, though.
Thank you.
She is ready.
She's ready. She's like, the
Yes.
vaccine. So about that vaccine.
Yes. Love
All
it.
right.
Yes.
Let's introduce our next guest.
Okay, so we are very fortunate to have Ms. Paulette Delis. She's a registered dental hygienist. And so the first thing, she's a proud mother. She's raising 3 young men along with her husband of 20 years. And so she's coming from Louisiana. She's joining us. And she's been a dedicated dental hygienist, committed to serving her patients for over 20 years. And so she accepted our invitation to participate on When Docs Talk in order to give a voice for the millions of fellow Americans who are passionate about their medical and bodily freedom. So thank you, Ms. Paulette, for coming and joining us.
Thank you so much for having me tonight. I really appreciate being here with y'all. I'd like to say today is Happy Constitution Day. How ironic that we happen to be talking about that. It is. And just to bring to the attention that it's the day that everybody gathered to sign that important document that we all cherish so much. And I feel like we're all coming together as Americans right now. We need to figure out how to do that and how to come to common ground on this.
Absolutely. Absolutely. Thank you for joining us. And I agree. I'd like to bring on some of our expert panel as we have our first discussion of the night about masks. Let's make sure everybody's on here who's supposed to. Okay. So, Crystal, I know you started talking about the vaccine. But our first discussion in the COVID culture wars is about masks, and especially about masks in school, okay? We can talk about it as a whole, but I really want us to touch about our school kids who all just went to school recently and who are kind of surrounded in this battlefield between parents about whether masks should be used or not. And so what I wanted to ask is, let me start with Dr. Wiley. Why should we be wearing masks? As an infectious disease specialist, why should our kids wear masks in school?
So it's really simple to me. We need to have our children and our teachers masked to protect our children. So what we know, without a doubt, is that masks decrease transmission of droplets. So that is, respiratory viruses, cold viruses, influenza, and COVID. Okay. So the importance of wearing masks is to decrease transmission. Why is decreasing transmission important? It is important because our job as, parents and, US citizens is to protect others. And if you have a child in the school system who happens to have cystic fibrosis or sickle cell or cancer that you may or may not know of, this is one way that we can decrease the likelihood of transmission within the schools to protect our children.
Okay, fair enough. And that's kind of what a lot of us in the medical community have always thought about it. I'm interested to talk to our guests who are a little bit on the fence or completely against wearing masks. I know that I spoke with you, Crystal, and you were kind of like in some situations, yes, and in others, no. But Paulette, you had some very strong opinions about why you didn't think that we should put masks on school children to protect them. Can you share some of those opinions with us, please?
It's for several reasons, and I think we're all in different phases of this. In my district, in my school district, I have 3 kids in 3 different schools. So last year we went to schedule. When we went to school a little off schedule, we were a little late returning in 2020. And I kind of had 3 different takes on it from 3 different schools. So my youngest, being he was in 2nd grade, he wasn't required to wear a mask to school. It was 3rd grade and up. So pretty much his whole school, other than the 3rd graders, because it's pre-K through 3rd, was maskless. And my other 2 children, they had full mask in their schools, and I just feel like, for instance, I just think some of this is getting overdone. I feel like, honestly, we would get phone calls whenever they had a COVID contact. If you came in close contact, you would have to quarantine. Luckily, my children never had to quarantine. One of them did, but the rest were okay. And for the little one, honestly, for the majority or for the biggest part of the beginning of the school year, we hardly got any COVID calls, because every time they had a COVID case, they had to call and make a robocall and announce to everybody that there was a case in the school. And I honestly feel like they had less cases than the other 2 schools. This is just my observation from what I saw in our community. I guess I take a different stance on this. When COVID came, it's not that I don't believe it's real. I have friends and family that have had family members in serious condition. I've also had a lot of friends and family that have had COVID and recovered. Some that were in the hospital and got out, some that hardly had any symptoms at all. And I just feel like there's another agenda too behind it. And I think I'm speaking for a lot of other Americans right now that feel that way. That have seen this coming for a long time. And it worries me about our kids, what we're raising them, the fear that we're instilling in them, the sense of humanity. In one aspect, I know y'all would probably say you're trying to save the community and you're doing it in defense of others, and I get that. And I feel bad when people think that we don't care about others, because I totally care about others. I just wish that we had other options. As an American, I feel like everybody should have options. And I feel like to make everybody stick to one protocol and like the vaccine and the mask are the only thing available, I think we should be pushing other things. And I feel like every time people or other doctors step outside of that box, they're chastised and they're shunned, like they're not true medical professionals. when they have the same degrees as the others. They just think a little differently. And some of us take care of our health a little differently than others. You know, for me,
Granted. I'm sorry. I'm so sorry to interrupt you because you said a lot and it's a lot of important information. And thank you so much for sharing your perspective on that. I just want to say that it is quite clear that most doctors, by and large, and certainly pediatricians who are taking care of children, including the American Academy of Pediatrics, support these. So the very few doctors that do not support mask mandates, and the even fewer group of doctors who don't support the vaccine, when they come out and they make their statements, they're often examined. And a lot of times when we look at those doctors' credentials, and this is not all of them, they're not on the front lines. Some of them haven't been practicing medicine. And I think that speaks to that. But I want to kind of get some feedback from our resident pediatrician here, Dr. Keisha Frazier-Doe. Paulette has said a lot of things about her concerns and how, she felt that last year her kids didn't have to wear masks and it really wasn't that bad. And she feels like there's not a one size fits all. Talk to us a little bit about masks in school children as a pediatrician.
So I think there's a lot of things that are different this year for children. Number one, the Delta variant is more contagious, so it's more transmissible. So I think that is definitely one impact. Another thing is that there was a lot more less spread and less involvement of people last year. Was a little bit more shut down and lockdown. So that also impacted the schools that did not have as much spread as they do this year. So I think that may have been part of what Paulette was experiencing. I definitely do hear and understand the concerns that parents have about their children wearing masks and feeling that that may limit them. But there are so many other requirements that we require of children that they readily do. For example, I'm sure Paulette's kids' school won't let them just wear anything to school. And so I feel like those are the rules and restrictions that we all have in society. Some of them are temporary, some of them are permanent. And so a mask that will temporarily decrease transmission to other people, to other vulnerable family members, I feel is something that a child can do for a few months or a few years as need be, probably more so a few months, is doable.
Yeah. You mentioned about the Delta variant, and I think it's very important for us to bring that up. This is the game changer because a lot of people complained, hey, I had a great summer. We were able to go out more. There were less restrictions. My kids didn't have to wear masks in their camps. What's going on all of a sudden that things have changed? And Dr. Frazier, you mentioned the Delta variant. So I wanted to just share some details with our viewers. What's the deal with Delta? Okay. What's going on with the Delta variant? It's important to note that this is a mutation or a variant of the original coronavirus that we saw earlier, and that this variant is more contagious. In fact, it can cause more than 2 times as many infections because it replicates faster. So it divides and grows faster, produces more particles. You can have up to 1,000 times more viral load, and is even as contagious as most of us have a reference of the chicken pox if you didn't get that vaccine because of how wise you are, a little older. So chickenpox is quite contagious. So that's the main difference. You're right, Paulette. Last year, kids didn't wear masks at the end of the school year. The Delta variant wasn't as strong and prevalent, and that's why the CDC and the American Academy of Pediatrics changed their viewpoints. But Crystal, you had a little bit of a different opinion on it. You and I spoke. Tell us what your thoughts are on masks in school, please.
I don't think they should be mandated, but during certain areas, I believe they could be allowed, like during the bus, because it's so crowded on the bus, right? And then when you get to class, hopefully the teacher or whoever sanitized, wipe everything down. When the kids comes in, take your mask off, right? So a couple minutes before they leave, sanitize. The kids are old enough, sanitize the desk, spray the room. So when they transition, the room is clean. And of course, when they transition, they'll also have the mask. But I don't want my kid to fully have to wear a mask 7-8 hours a day because they do complain with headaches. They're tired. And now then I did a research, like it comes out of I guess Germany, 60% or 68% of the children, common issues, irritability, headaches, difficulty concentrating, sadness. They don't want to go to school, malaise, impaired learning, fatigue, their drowsiness. They have rashes. 25% also develop anxieties. So I don't think we should mandate them to wear a mask all day.
I agree 100% on that.
Thank you. I want our some of our experts or other guests to comment on that study, because I've heard that study cited quite a bit, and actually has been discredited and retracted in many instances, because they realized that a lot of those variables, first of all, those are very much attributable to COVID, except for rash, okay? And secondarily, the sample size was not enough to make a statement about it. Weigh in, other people. What are your thoughts on wearing masks, limited areas, and masks being dangerous or uncomfortable for children?
So the way I like to think about it is, do any of us want to wear masks? I don't want to wear a mask every day, but I don't want to risk getting someone else sick. The way that I like to think about it, and what I tell my little cousins, et cetera, is it comfortable? No. But contracting COVID, increasing the risk of you dying and having shortness of breath and going into the hospital and having what we call long COVID. It's about risk versus benefits. And I appreciate that, both of you are on here, because we really do need to hear and have these conversations, because so many people in the United States feel exactly the way that you do. What I also want to say as well is, when it comes to one's rights, your child doesn't have to wear a mask. However, you may have to keep your child at home. It's about is it okay for us to have practices that will put someone else's life at risk? And what we're seeing also over the last couple months is significant increases in children contracting COVID. Last year, everyone liked to say, oh, kids don't get COVID, kids don't get COVID. Children contract COVID, children transmit COVID. And also, it's really important to know too, is that you are extremely infectious before you develop symptoms. So another reason that I wear my mask is I would be concerned, even if I felt fantastic, that if I have contracted COVID, that I have an increased likelihood of giving it to some other immunocompromised, older, or a child. So it's about risk benefit. Are they comfortable? Do I like them? No. But it is what's necessary to decrease transmission for all of us to get out of the pandemic.
Absolutely. Keisha?
Another thing I would like to add is that I really feel, as a parent and also a pediatric emergency medicine doctor, that part of the discomfort that people feel with masks is they really haven't found the right one. There are so many different types of masks out there. So as a parent, I actually probably tried about 10 different brands of masks on my child who has a little bit of a sensitivity issue before we found the right mask. Mm-hmm. I've oftentimes seen kids in the emergency department who were wearing masks that were inappropriate. They were too small. So I feel like some of these studies are also on kids who are wearing inappropriate masks that were too small, that were not fitting. And so that is also another aspect. Just like you have to get fitted for a bra, you should also get fitted for your mask and make sure your mask size is comfortable for you. So one of the things I guess bothers me about the discomfort issue is I really feel like there's so many other things that is discomforting for kids. It's not comfortable to sit in your chair all day long. The teacher makes you do it and you do it. We find solutions to that. We go out for recess. So, the same thing can happen with the mask. You find a solution for it. Maybe they go outside and have a mask break. It's also uncomfortable to, have to sit and do these standardized tests for so long, but we find a solution for that. There are the same accommodations that can definitely be made for the mask.
And I just want to say one thing about anxiety with masks. I've spoken to many pediatricians. They don't report that, but that's neither here nor there. That's anecdote. That's not studies, right? But I can tell you that there are also kids in the other direction who feel very anxious because they're returning to school after a year of largely being at home and knowing that there's this deadly disease out there and feeling like they are not being well protected. God is my witness. If I didn't have a little girl, 11 years old, who I saw in the emergency department, who told me that she felt the adults were trying to kill her. And I looked at her, I said, what do you mean? What does that mean? And she said, nobody's wearing a mask, and we know that we can't get vaccines. Vaccines, we know, help us against COVID. And there are so many people in my class who have tested positive for COVID, and some of them are really sick. And now I'm sick. She was sick. That's why she was there. And she said, even the principal doesn't wear a mask. And when they see people coughing, they don't say anything. They don't do anything. And I'm scared. I feel like it's a conspiracy that people are trying to kill the kids off. So she's anxious about the fact that she's in an environment where the only protections that are really available to her are masking, social distancing, hand washing. And her school is doing neither of those, and especially the one that we've seen is most effective.
I'd like to take a moment and respond to Crystal about a couple of things. One, the surface decontamination is great. That's especially any place where you have small children, they're going to be spreading germs on surfaces. So wiping things down, I agree, is extremely important to do. It's cut down on spread of all sorts of viruses over the past year that people have been paying more attention to decontaminating surfaces, hand washing, and also distancing and mask wearing.
Yeah.
But one thing that really needs to be understood about how COVID is transmitted is that it is almost entirely transmitted through airborne droplets. So there's no amount of wiping down surfaces that's going to decrease transmission in a closed space. The only things you can do are you can increase ventilation, air filters may have some efficacy, and masking to decrease the amount of droplets that are circulating in the room and the amount of droplets that an individual is inhaling.
So I think that kind of addresses Crystal's point, because she was talking about, in areas where they're closely confined, like a school bus, she supports masks, but, she supports more of wiping down surfaces when they're in the classroom. But as Dr. Kirksey is mentioning, that won't help with the respiratory disease. I just want to share really quickly that at our children's school, they are mask optional this year, after being mask required last year and doing quite a few things to mitigate the spread of COVID-19. This year, they've made it mask optional. And it's been quite divisive in the school because there are several parents, especially medical parents, who are facing COVID every day, who have been largely in opposition of this. And one thing that the school tells us is, well, we're kind of respecting everyone's right. You have the right to wear a mask, and the other parent has a right to not send their child with a mask. But I want to point out the absurdity of a certain situation. For instance, imagine we were all swimming in a swimming pool, and they said, you know what, you can pee in this section of the pool. Yolanda and Crystal, you're welcome to pee there, but other people can go to the non-peeing section of the pool. I think you would all look at me cross-eyed and recognize that that's absurd. We all know that we're all going to get a little bit of that pee, right? That urine is going to disseminate. The same way that if you're on a plane and you're in a smoking section, you are also going to receive some of that smoking inhalation at some point, even if it's just minuscule amounts, okay? We know that COVID-19 spreads through respiratory droplets in the air. If you say this person can wear a mask, but this person doesn't have to, the people who are making the choice to not wear a mask are still making a choice for the other people who are not wearing a mask, because we can't escape the pee and we can't escape the smoke. So you're effectively encroaching upon my child's right to not have to be exposed to coronavirus. I see Ashley Bonhomme is saying that her child is 2 years old and she wears a mask. A young child wears a mask anytime they're out in public. It's the only protection measure available to her at her age. My child is happy and securely attached. I have noticed no evidence of anxiety or problems related to mask wearing. Thank you so much, Ashley. My 3-year-old thinks he's a superhero when he wears a mask. He literally wears it in the house sometimes to just play around.
I want to say something really quick, and then I want Paulette, I think she wanted to comment. My child is very young. When COVID started, he was 9 months old. So he was under the age of requirement to wear a mask. I probably overreacting, just basically sheltered him to death and just didn't go out anywhere. You're not going to Target. You're not going anywhere except for the place you absolutely have to go. Well, he turned 2, the 4th of July, a couple months ago. And we started practicing with wearing the mask. And I noticed that, like almost any change you do with a child, he's gone through 2 years of his life with no mask on. So, of course, he was not happy about having that mask on. In the house, outside, in the car, it did not matter. And he still isn't happy about having that mask on. But one thing I haven't noticed is I haven't noticed him have what I call his Ezra meltdown when he's legitimately upset about something. I think it's more so of he doesn't like wearing the mask. And, you know, the rest of us, we suck it up. We have to wear the mask because of work, because of bills, because of personal choice or whatever. But I find it interesting that a child who has had more of his life unmasked than he has had to wear a mask is able to at least try to adapt. And then there are grown adults who have mostly functioning minds who cannot seem to do the same thing for the health of the majority of people. I mean, the comfort of some, to me, does not outweigh the health of many.
Thoughts, Crystal? I'm sorry, Crystal or Paulette?
I mean, for me, I just have a very different view of this. I've always been raised to think that, you know, germs build our immune system, and I believe in our internal immune system, my God-given immune system. And I support that in me and my kids all the time. And I refuse to instill fear in them. Like, that makes me so sad about that little girl in that class, because I feel like she's growing up in a world where she's going to fear all that. And my kids have lived without a mask for these past 2 years. They've played with their friends outside and inside my house, and we've been fine.
Without COVID.
No, with COVID. I mean, no, I'm saying with COVID in our community, and we haven't had anybody around us that, I mean, we've had COVID, like we've had the neighborhood as kids have gotten COVID. It hasn't been a big deal. And we are not seeing kids dying of this. I feel like the flu is very transmissible. The flu is very contagious every year. My kids have gotten the flu. They get over it. Kids are very resilient to this, and we're missing this for them. We're instilling this fear. Like you're saying, that little girl is feeling like she's going to die of COVID. I have not seen any cases where, I mean, we have cases, but from what I'm hearing, a lot of these kids are sick kids to begin with. They have kids that have down immune systems, and I get that. And I get that they can wear masks, but I do believe that it should be parental choice. And I feel like if a mask works, if that works, then they're protected. And if they want to keep their distance, if I don't have a mask on, I don't go like hugging people, and I'm not going to certainly go coughing on people. Like, that's ridiculous, those videos that were showed earlier.
I agree. They're totally ridiculous. But kids can't socially distance like we can. We all know that. All of us who have kids know that kids are going to be together. But I want to address something you said that's really important, though. Really important. You mentioned that children don't die of COVID.
I did not mean that they don't die, but the cases are very rare. Children die of cancer. Children die of a lot of different means. I mean, we're sitting here this year and we're focusing solely on that. Have we ever taken flu and put those numbers up on TV every single year? Pneumonia, car crashes, airplane crashes. We would never want to do anything. We would live in fear if we focused on those numbers every single day of our life.
But the reason that we're having to focus on these things right now, you know, and what I can say is you are fortunate that your children have been safe and have not contracted COVID. You are fortunate, but there are a lot of people.
They did get COVID. Actually, she was saying.
Yeah,
he's fortunate that they did well with COVID.
Exactly. You are lucky that your children. Just a moment. You spoke just a moment. So you are very fortunate that your children contracted COVID and survived. That is not the case for everyone. And the fact is, children die from COVID. And with respects to influenza, we talk about the flu vaccine every year. Is it as, you know, are we talking about it as much as we're talking about COVID? No, we're not, because people are not dying as much as they are, with respect to COVID. So I'm so happy that your children did okay. However, a lot of people's children do not do okay. And so many of us on this panel are taking care of children and adults and, human beings that we are losing because of this. It is, and I believe in personal rights as well. So if someone does not want their child to wear a mask and there is a mask mandate in their school, that means that said child has to stay at home. So what we have to do right now is protect our children and protect our vulnerable. And that's all that anyone is trying to do. No, I don't think none of us want to infringe on anyone else's right. However, when it comes to protecting human beings, that's what we all have to do.
Absolutely. And not just that, it's not just about dying from COVID. That would be traumatic to a child. But what about having a family member die from COVID? There's a 15-year-old that I know personally who knows that he is the reason that COVID came back into his family, and he lost a parent because of that. I know a friend of mine whose husband was hospitalized in the ICU because his son brought COVID to the house. Now, the children did fine. You're right, Paulette. A lot of kids do okay with it. But how do they feel when their parents die or get sick? That's something we have to consider. It's not just whether they die or not. And it's not only sick children who are dying from COVID. There are cases here in Georgia where healthy, athletic children have died. We don't know how it's going to hit. And because we don't know how it's going to hit each person and each child, why not take a simple measure to help protect everybody? And it's so funny that we mention fear, because the same people who tend to be very staunchly opposed to masks have a fear mentality when it comes to the vaccine that they instill in their children and their family mates, and talk about how it causes all sorts of awful things. So there is fear mongering, if you will, to go around. Anyway.
I just wanted to interject. If you would actually look, I would disagree with the fact that children are not getting sick with COVID. So about 2 weeks ago, there was a big announcement from the Children's Hospital Association saying that basically we're full. All children's hospitals, most of them, definitely the ones in the South and the Southwest, are full. They hardly have any beds. ICU capacity is at the highest level it's ever been. I work at a pediatric emergency department, and we every day have ICU beds that are completely full. So it's not true that children are not getting sick. There's actually been a 29%, a big increase. The kids are about a quarter of the kids who are actually the ones who are actually infected with COVID currently. All the test cases are 29% of them are children. So a large percent of kids are actually infected with COVID. And there's also something called multi-system inflammatory disease in children, which actually has been killing very healthy children. Healthy football player kids have died who had no medical problems from this. So that basically is a post-inflammatory problem. You catch COVID 4 to 6 weeks later, sometimes 2 weeks later, you get something called MIS-C. And in our state, in Georgia, we've had about 200 to 300 cases. That is actually more cases than the amount of kids who die from the flu each year, in just the amount of cases we've had in our state. So that is actually not true that children do not get sick. They can get significantly sick. And I would just also think to say that things that we also have to factor in is you get sick from COVID and you are out of school for 10 days, 14 days, 3 weeks. That impact right there on loss of school time is also really relevant. We actually talked earlier about how infectious chickenpox is and how COVID, the current Delta variant, is the same. Really, that they're very similar in so many different ways. One of the reasons why we vaccinate against the chickenpox disease is because of the impact on loss of school time. So that is really impactful too. Think of the amount of weeks that kids are missing from school because they were infected with COVID, because they were quarantined. And if we were just wearing them, if kids were wearing masks, they're less likely to be infected and less likely to be quarantined and less likely to miss time from school, which is also another impact.
Okay. Crystal, do you have any words on this? I know that you were talking about masks before and the discomfort that it caused your children. We're going to close out the mask debate soon. I just wanted to get some last thoughts from everyone on here, starting with you.
when they went to school, like last year, they had to wear it. They got tired of it, but they wore it, faithfully. Then this year, it's optional. I gave them the choice. Do you want to wear it? Yes. No. We can put one in your backpack just in case you decide. No, I'm okay, Mom. I don't want to wear it. It's fine. Back in January, my husband got COVID. He was supposed to be the one less likely to get COVID versus me and the kids were always out in the public, this or that. Why did he get COVID? Okay, he's been around us. So once we found out, the first test was negative, second test was positive. You're positive, you're going to the quarantine room because the rest of the family has to function. Now, we isolated him in that room, not knowing, like, are we going to get it? Are we next? Waited a couple of days. We all went. I took my kids. We all tested negative. Nobody got it. So after 2 weeks, he came out. Now it's what, eight months later, like 10, 12 days ago, my daughter got it. Well, we quarantined. She came home Friday. She didn't feel well. I'm thinking it's strep. She always gets strep. She's the weakest. Take her to urgent care, get antibiotics so she can go back to school after 2 days. They tested for flu, strep, COVID. Positive for COVID. I'm like, are you sure she has COVID? So she comes home. Now it's Saturday. She's been in our bed Friday. She's been in our bed Saturday morning. Once we found out she had COVID, okay, you have to quarantine. I'm sorry, but still the rest of the family has to function. So I quarantined her to her room. I sprayed everything down. She could only come out to use the bathroom. Like when I would go in, because I do have an autoimmune disease. So when I would go in, I did wear a mask. I opened her window and she didn't wear a mask. That's her room. So only one person wore the mask and nobody else got it. So I asked the protocol at work, hey, my daughter she's positive. It's been a couple of days later. Nobody else in the house has experienced any symptoms. Can I come to work or do I need to stay home? If you don't experience anything, you need to come to work. Same thing with school. With school, my daughter will get excused, but my son will not. He will miss 10 days and it will count against him. It's not where he can get excused from it. So like if he's not experiencing any symptoms, they come to school. They suggest you wear a mask, but it's not enforced. So
even if he's been exposed to COVID.
And I told him, no, your sister tested positive. So what you can do is when you get on that bus, you wear a mask. When you get into the classroom, you can take it off. But when you transition, put the mask on. And then we did contact, because my daughter had a best friend that helped her that day when she was sick. We contacted, hey, Isabella is positive. Watch your daughters. And they didn't get COVID or nothing.
Well, that's great. One thing I noticed is that you, and thank you for sharing your personal story. It sounds like when you were interacting with your daughter, you used a mask. And you did not contact COVID. And that leads me to the point that I want to close off this discussion with on masks particularly, is that some people who are advocates for not masking frequently state that they don't think that masks work, that they don't work. But you've just given a personal story to suggest that they do work. They do prevent the spread. A lot of people, including our children's school, when a child has been exposed or has had COVID, they ask that the child come back with masks. This suggests that at least there's some buy-in to the fact that masks work. But I do want to, because there are a few doctors that we've spoken with, including an emergency doctor, Dr. Walker, that I had the opportunity to speak with, who said, it's not that I don't support masks because there's something wrong with masks. I just don't think they work that well. I don't think there's evidence really to suggest they work well. And the vaccine is the best anyway. So I agree that the vaccine is the best, but to close off the discussion on masks in school, I do want to share with you all as our viewers a few things. So there have been a lot of great studies that have suggested that there is effectiveness when you wear a mask in controlling the spread. JAMA wrote an article, the Journal of American Medicine, showing that community mask wearing definitely substantially reduced transmission of COVID. It was based on the principles that you're blocking the virus from traveling in particles, both from the person who is masked and the person who is wearing the mask. And so you have a double protection, which is why universal masking, meaning you wear a mask, I wear a mask in school, is really effective. A really important study I want to drop with you all is a study that they did in North Carolina at Duke. And this is important because it studied over 1 million kids and 160,000 staff. And they showed that when people were wearing masks, it was safe for everybody to be in school in person, because that's where kids belong. They don't really belong on online learning. I think we can all agree that the best place for kids to learn is in a classroom setting. And the study, and I'll put it up here again, if we could just remove the comment, did show that if we mask, we will be able to relax some of these quarantine guidelines. Some of you have been in schools where you've had whole classrooms quarantined because one person had a case. But the study suggested that if we're all masking and masking properly, we probably don't need to send whole classrooms home of kids. We probably can just send kids who are showing symptoms, because the likelihood that everyone's going to get it is lower. And there's one last study that I want to share with you all that looked at masking as a whole in a community in Bangladesh, over 340,000 people. And it was kind of the gold standard of scientific studies, a randomized controlled trial. And it showed that you can increase people's masking use, even for people who are not really happy or used to wearing masks. They can learn to use it. So they demonstrated that. But they also demonstrated that when the community was masking, there was less transmission in COVID-19, especially for older people, which we all know are more vulnerable when it comes to masking.
And then I know we're about to end the segment. The other thing is too, I think from the standpoint of the difference, there was a discussion about the difference of severity of disease with people if they got it versus not. And the thing is, from the standpoint of, we recognize that the mask decreased transmission. And we are trying to also create a situation where we're trying to stop some of the hemorrhage from the standpoint of our medical system. Today, I mean, there was no beds to send anybody to the hospital, if they were sick and had COVID. So, from the standpoint of even trying to create measures in which that are non-invasive to try to mitigate some of this, the burden that we have on the health system. I mean, it is so bad right now from the standpoint because of COVID, and because when somebody gets COVID, they could be in the hospital for 2 days or for 2 months.
Right.
If they're intubated, and then after that, from the standpoint of post-care and rehab, those kind of things. So that's the thing, the burden of this disease. That's what's so different about it. When people compare it to the flu, or even I saw a comment where somebody was saying that TB kills more people in a year. That's the leading cause of death in the world. But the thing is, what does it do to the health system? What is the health burden from that disease? And I think that's really right now, I mean, across the United States, there are systems that are crying out. I think somebody had put on there, they live in Texas, they're sending patients to Oklahoma. There was a case where this guy, he had gallbladder pancreatitis, something that's totally treatable in Texas. He died because, he had his ER physician on Facebook begging anybody to take him because he could live. He had a preventable disease, but there was nobody to take him because all of the ICUs are full of people with COVID. So that's the other thing too, to try to decrease the amount of people that we have in the health system. That's one of the other reasons why we try to tell people and push masks, because once again, that's something that's not invasive and something that can help in order to even help. God forbid somebody comes in, there's no ICU beds and they have a stroke or a heart attack.
Yeah.
Which we're
Which we're seeing all the time. Forget about ICU beds. We work in the same place. There have been times there's no place in the ER to see people, and we've had patients waiting who have appendicitis who are just sitting because there's not even a nook, cranny, or corner to see that patient. These are all great points. I get the passion that you have, Paulette and Crystal. I thank our experts and our expert WDT crew for weighing in. We're going to cut to the next issue after this quick commercial break.
Hi, I'm Dr. Anwar Osborne. There's been some confusion lately about wearing masks, and I want to give you the facts. Masks are like your drawers. Follow drawers rules. Rule number 1, don't let anything hang out. Nothing should be peeking out of your drawers ever. None of this. None of this. You can't bird box the Rona. Rule number 2, don't adjust in public. Would you really dig deep to pick out a wedgie? No. Don't adjust them in public with your hands. Your hands carry germs. Wash those nasty things before you put your mask on and before you take it off. Rule number 3, keep them off the table. When you go to a restaurant, would you just casually toss your dirty drawers on the table? I don't need your Fruit of the Looms next to my guacamole. No bueno. Rule number 4, wash them or be nasty. If your mask has more stains on it than the Tupperware you use to store your tomato sauce, you got problems. If it has holes in it, trash it. Wash your mask. Rule number 5, don't swap them. Don't share them with your friends. Hey, bro, can I borrow your boxes real quick to just run in that store over there? I mean, for real, remember the rules. Don't let anything hang out. Don't adjust anything in public. Keep them off the table. Wash them or be nasty. And don't swap them. Most importantly, wear them. Now you know. Don't forget it.
Okay. Yes. Just some mask rules for preventing the spread. You have to wear them. You kind of have to wear them properly, right? Like you can't just wear masks the wrong way. Otherwise, you're absolutely right. They're ineffective. So we always think that that's a nice little comic relief so that this is not all tension, disagreement. And one thing that he mentions is that you got to wash your mask. Some parents do bring up that it's not sanitary for their kids to be breathing, dirty masks. They should really be clean masks. And I personally prefer surgical masks, but that's my own bias. So now we are going to delve into discussion about the vaccine, the COVID-19 vaccine. This, as you all can agree, is another very large issue of contention. We have people fighting about it. We have people on different sides of it throughout the community, including the medical community, although most medical practitioners do support the COVID-19 vaccine as a mechanism to prevent the spread of COVID. So let's talk about it. What do you all think about the vaccine? Not the people who I know are all in support of it. I know everyone on this panel that is a physician is in support of the vaccine. And we have Davida joining us as our resident nurse, who is also a vaccine supporter. Let me ask another question to start off.
Oof.
Who is everybody on this stage right now on this screen? Is everyone vaccinated?
Yes, absolutely.
Yeah. Okay. You had, Paulette, some very strong opposition to the vaccine, and I wanted you to share your reasoning, your rationale, why you don't support the COVID-19 vaccine.
I'm not saying that y'all can't be vaccinated. I totally think it is a personal decision based on everybody's personal health history, medical background. And what bothers me is the force in which it is being placed on everybody. You have nurses who are having to walk away from their career and jobs and they've been working throughout this whole pandemic. And now because they don't believe in the vaccine, or they might have other measures of preventing this for themselves and their family, they're being forced out of their job. I mean, I have a relative who's a nurse that sits behind a computer and a friend at home, and they're being told they have to get the vaccine when they're not even in contact with patients. This makes no sense whatsoever to me. It's like when I understand y'all's fears, but some people don't have these fears. And it's unfortunate that y'all can tell me, oh, well, pull your kid out of school if they don't want to wear a mask. Well, I still feel like too, I mean, if you can say that to me, I can say, why don't you pull your kid at school and keep them at home if you're that scared of it? There's some of us that want to live freely. And I have been living freely, and I'm telling you that for a year and a half. We've gone on vacations. We've been in contact with people in crowds. I don't understand how these football games can go on in colleges, and they're basically being turned away at the door and saying, you can go to that tent and get your first vaccine, and then you can come in the door and not wear a mask. I want all of you doctors to answer me this. How quickly is that vaccine going to work? It's not going to work from the time they get it at that tent and walk into that stadium. This is like we're getting cattle coming through a door, and I'm not meaning to be mean, but it's just the rules don't make sense to me. The rules don't make sense to me that we can go in a restaurant, walk to a table with a mask on, but our kids can't sit at a desk and not wear it. And it's just the rules don't add up. The numbers to me don't always add up. And I've had things with testing that don't make sense to me. I think they're a false positive test. And I think that you can't blame somebody for giving you something that you can't see. And that's the thing that breaks my heart is these kids are being told, oh, you gave this to your dad and he ended up in the hospital. How do we know that child passed it on to their dad? How do you know the dad didn't get it from the gas station and he might have just had a different immune system that developed it later? We all have different bodies and we all have different things and we all have our beliefs and our concerns, and we need to get back to we're Americans here. And when this virus is not going to go away, and I fear that the final variant of this whole thing is communism, because this is where we're headed, where we can't make an agreement. I don't understand that. I don't understand it.
So
I love everybody. I love your opinion, and you can do that, but don't force that on somebody else. Nobody should be forcing anything on anybody. And this is what's causing the division in this country.
Right. And I want Davida to weigh in and just to understand that people feel that they're being forced to contract a disease because of choices like that you might be making. But Davida, you wanted to say something.
Yes. Paulette, let me start off by saying that I absolutely, I understand why I could possibly understand why your perspective on COVID and mask mandates and vaccination is completely different from mine. And I think it has a lot to do with your experience with COVID. Like you mentioned earlier, you've had people in your family and you know people that have had COVID and they really didn't have any long-term or fatal outcomes. However, I'm sorry, I just didn't know that part. But I think my perspective is really different because I went to New York when it first happened, when we were learning something different every day about COVID. We didn't know exactly we had some idea of how it was transmitted, but as far as like what to do to prevent it, we were learning something different every single day. And the way that I was seeing people die was completely different. Like I've been an ER nurse for 6 years. And the way that I was seeing people die, and they were trying to equate it to how people die from the flu or something completely different. I've seen kids die from COVID. I've seen completely healthy teenagers die from COVID. So my experience and my perspective is completely different. I did have a lot of reservations about getting vaccinated when it first came out. Probably some that I probably share with you. I feel like it's fairly new. We're still learning things about this virus. There's some things that we probably don't understand at this point. But ultimately, I did my research and I did feel that for me, it was the most appropriate decision. However, and I completely understand if you don't agree with that. Like you said, everybody's subjected to their own opinion. I do think that when it comes to matters of public safety, that discomfort isn't the priority of public safety. And also I wanted to say, I did want to hear more of you and Crystal's opinions about the information that you learned today, or if you didn't hear this before, or you had some misconceptions about things, like what your response will be, or what it has, if it changed or not. Just to hear like people that actually work in these fields and are experts that have more thorough knowledge of the information that you probably heard from whatever sources you got your information from. Did it change your perspective? Do you feel more educated, or you just feel like my stance is my stance, it's going to remain this way, or I want to look into that more? Just whatever you probably felt from the information that you learned.
Well, Crystal, why don't you weigh in? We haven't heard from you in a bit on this topic.
On like about the vaccine or
Yes.
Well, mask and vaccines or how it's transmitted, everything.
I do believe like you should hear everybody, like where they come from.
Right.
So you can get a perspective, and sometimes it'll change your opinions and sometimes it doesn't, because at the end of the day, you still believe in what you believe. But I believe in hearing from both sides, because then it's like, oh, wow, I didn't think of it like this. So now let me,
I think we got her frozen a little bit. But as soon as and so she was saying something so powerful. It's true. We really need to look at both sides of it. Are you back? Yeah, she's back with us. Go ahead, Crystal.
Yes, I believe you should also, take in consideration both sides, because from the opposite side, it's like, well, I didn't see it like this. Well, let me look at it in your shoes, in your eyes. I will. And at the end of the day, if I still feel my way, at least I looked at it from your side.
Right.
But for the vaccine, I still believe it's not my business if my friend gets it, that vaccinated, or my neighbor. It's none of my business.
Right.
That should be your family's choice, your own personal choice. I shouldn't be, in that. At the end of the day, whether you get it or not, it's your choice. You're going to have to answer for that. I don't believe in the mandate or getting bullied into taking the vaccine. I think a lot of people, they feel bullied into the vaccine, or from my coworkers, they're like, it was peer pressure. Well, if it was peer pressure, why did you get it? You shouldn't got it because of peer pressure. You should have got it because you felt it was safe and it was the right thing for you to do, not what other people tells you should do.
Correct. I agree. Yeah.
So it's really about the mandate and so forth. But what do you feel about the fact that there are several vaccines that have been mandated throughout? I mean, kids have to submit vaccine requirements to school a lot of times to attend. So it's not really a new thing per se.
I think because I'm, for vaccines, but I think a lot of people, it's still really new, and now like when they start mandating and forcing it, a lot of people from my side is like, wait a minute, let me think about it. And then you're starting, well, if you don't get the vaccine, you're out, you're getting fired, or we're going to take this away from you. Now we're getting punished for not getting it, And then
I'm sorry to interrupt.
Go ahead. No, go ahead.
I think that my dad is the same way. He is very reluctant to get the vaccine, but he's a very avid mask wearer. He has his reasons for it, and I'm sure you probably have your reasons for not getting the vaccine. I think that, like you're saying, that was one of my reservations. Like, it was really new. There isn't a lot of research about it. How did they come up with the vaccine so quickly? And they're trying to push it on everybody, and they're trying to take away. I think a lot of these questions came up because this is an unprecedented thing. Like, COVID has never been to the point where first of all, COVID just appeared, and the way we had to shut the world down, stop international flights, shut down the economy. This is unprecedented. So there are a lot of things that have never happened before that we had to do to mitigate transmission of this virus. Right. I understand people's hesitations, and I'm not saying that you're not entitled to feeling that way. I completely understand everything that you're saying. I do feel like if you make the personal choice to not get vaccinated, which you are entitled, that you should also make accommodations to live that lifestyle. And Paulette was saying something. She said that, well, if you're fearing that your child will go to school and masks are not required, that it should be reversed. That if the child doesn't want to get COVID from not having a mask being mandated at the school, then they should probably stay home. But that doesn't help mitigate transmission of this virus. So I personally think that. And I'm just sharing my own opinion. Like I said, I'm not trying to make it seem like everybody is wrong or right. But if you're trying to stop or lower the numbers, and what I've seen we gave the numbers in the first part of the first segment of the show, yes. All the numbers that are in just America alone, like hundreds of thousands of people have died in ways that we didn't understand at first, that we've come to learn how this virus actually affects the body. So if you see that these people are dying in these ways, and thankfully, you know, some people get it and they just have a mild headache or they don't have any symptoms at all, but you also see the extremes, and when people have been ventilated or they have to have ECMO or like all these other like extreme cases, if you can do something as non-invasive as wearing a mask, oh Lord.
I know it's hard because, you know, we've seen so much, and it's like it's frustrating for us who have seen, which brings me to a point that I want to address. So you talk about fear. And if you all want to live in fear, not you, David, I think it was Paulette you mentioned, if we're not scared, I think it's important to deal with facts and not feeling. We're not scared because of some irrational thing. This is something that we see with the data. And even if I was a kind of doubting Thomas, if you will, and I didn't really believe it because I'm not, you know, I don't trust medical science data, we're living in it. We know this is something to be scared of. So if somebody comes and says, you know, I'm not scared of HIV or any other thing, and that's why I'm going to do things that could maybe endanger others, and it's not fair that I'm not scared, I have the right to not be fearful, it's still dangerous to others, whether you want to be fearful of it or not. I mean, that is actually a choice. If you want to fear it or not, that's fine. We're not saying you need to fear it. I don't fear it because I think we can fight it with the right mechanisms. But if you want to fear it, that is a choice. But I don't think it should be a choice when it starts to encroach on other people's chance at wellness, other people's chance to not contract it.
Can I say something?
Of course.
But this isn't what I think my message is getting across wrong, because y'all, you feel that the mask and the vaccine work just like I feel that my steps that I take work. And I feel like a lot of people that feel the same way as I do and that do the same things as I do, it's just a different way of treating what we're dealing with. Mm-hmm. And I feel like we all need to respect that. What I'm doing for me and my family is working for me and my family. Yeah. And the way I look at it is I look at physicians who think very differently than y'all. And they have a different message. And it's crazy that we have all these, we have a panel right here. We should have physicians that maybe think a little outside the box.
It's so funny that you mentioned that, because we did seek physicians. There were so few and far between. And I mean, in different social circles, academic societies, most physicians do not agree with what you're saying. The very few that did were nuanced. So there's the one doctor, Dr. Walker, who said he would have loved to join, but he's actually working today, saving lives. And he said he absolutely doesn't think that we should be mandating masks because he doesn't think they work. Not because it's not a good thing, not because they cause anxiety, not because of personal liberty, but because he doesn't think they work. And we're having a discussion where I'm going to share some of the data with him, but he absolutely agrees with the vaccine. So you're right. We would want to have somebody who's in the medical field, but this should say something maybe to you, that there aren't a lot of people in the medical field who are practicing medicine on the front lines. I'm going to qualify it, who are practicing medicine on the front lines and who are still credentialed, who feel strongly against the vaccine and strongly against masks. And if you find them, I implore you, please send me their information.
I have a question.
Can I just say, because Paula, you mentioned that that we have a feeling about the right way to do things, and you have a feeling that the things that you've been doing have been working for your family. And I just want to reiterate that I think part of the reason that there's such a discrepancy and why you see on so many of these panels so many scientists and physicians who are falling down on the same side, it's because we tend to follow the data, and we've studied the data and we know how to interpret the data, in addition to our firsthand experiences both at home and working in the hospital. And so it's not a question for most of us of a feeling about what's the best thing to do. It's what the data actually supports and what the evidence shows. And so while your family may have been okay with the practices that you are taking, there's a huge amount of data at this point saying that practices that do not involve distancing, masking, hygiene, and vaccination lead to much higher rates of circulation of COVID in the communities, much more people who are sick and hospitalized, people who are overburdening the hospital system, conditions where care is having to be rationed for people with and without COVID in these hospital systems, and higher rates of death. So while your family may be okay and you therefore have a strong feeling that your methods are working for your individual family, they are not working for the larger community. And the question for most of us, the reason that we go into these fields, is to try to protect as many people as possible as we can from any adverse medical outcomes. And the other thing, and no one really addressed this specifically, but I hear people talk about concerns about the safety of the vaccine compared to the safety of the virus. And that's really, I think, the question that you have to answer. It's a balance of risks, right? And those of us who are working in the medical field can see very clearly that day after day after day, month after month after month, and now going into year after year, people getting extremely sick and dying and being debilitated from COVID. And we are not seeing that happen with the millions and millions of people who are getting vaccines. It's the evidence in the data and the evidence in our daily practice supports the safety of the vaccines for individuals and for communities far over the impact of COVID.
Very good point. Thank you.
I have a question for Crystal and Paulette. I know you're trying to end the segment, just to end it. I know a lot of the throughout the segment, you've both mentioned on accounts where you receive. I know Crystal came with her receipts, honey. She came with the information from Germany, and she quoted the information. Do you feel that? And Paulette made a point in saying that, okay, well, when she went to the football game, do you think that the vaccine is going to protect you from that time to actually enter in the arena? Do you think that the information that you're getting, because it's so contradictory, it influences your own perspective on getting vaccinated? Do you think that what do you think is heavily influencing, or let me rephrase that. What information do you feel is in support of you not getting vaccinated or not wearing masks?
Crystal, you can go first if you like.
We only have time for one response.
Oh.
You can go ahead.
I mean, for me, I feel like there are adverse events that happen with these vaccines, whether we want to admit it or not. And I feel like there's VAERS, which was set up, because there's no liability for the vaccine companies. And there are side effects. I mean, you can look up on the CDC website and see, Guillain-Barré syndrome, all these different things. You can go to the ABC news feed. It was an affiliate, WXYZ TV. They put a news piece out, and they wanted people to make comments on family members or loved ones who had died of COVID that were refusing or delaying the vaccine, and it completely backfired on them. Just go listen and go read some of the reviews on that. And it was more people saying that they had loved ones that had gotten the vaccine and then died of a heart attack or a stroke or just different things. And I mean, I'm just saying, go read it. I look at that, and I look at personal testimonies too, and I feel like there's something, it's a personal, most people don't even know that VAERS exist. And most physicians are not going to report it there. And they're not going to make the connection, because how can you prove it, right?
Right.
But if you go and see, there's so much that's suppressed in that world of things. And, I have a child that had a reaction to a vaccine years ago. And it kind of changed my viewpoint on things, because I was a vaxxer. Until something happened in my family and it was brought to my attention. And I mean, right now I have medical exemptions for my family. I fear that those aren't going to be held up at some point. People are feeling like their backs against the wall with all this, that these mandates are coming really heavy on us. And it's sad. It's sad that nurses are walking away from their job when they've been working so hard for a year and a half. look online. There's tons of testimonies on that. I just, I see y'all's side. I see those videos you posted, but go and look on the other side, because there's always another side.
I absolutely think that. I think that's important.
Can I say one more thing? Can I say one more thing?
Sure, one more thing.
There are places you can go, and there's a lot out there, and there's a lot that are causing people to question numbers, to question testing, to question. I mean, there was a big thing recently in Louisiana, this Delta variant, that the hospitals were overloaded, and people were going into emergency rooms and filming, and there was nobody in the waiting rooms. And so there's a distrust here, I feel like, too. And I don't know if it's just down here in the South, but I feel like there is. And I feel like there's a growing movement of people that are just feeling like they're really being pressured.
And Paulette,
pressure people.
And Paulette, I want to thank you for being so, because I know that this is not easy, being here with 6 healthcare workers saying something that's different from you. And you're right, 50% of the United States feels the way that you do. What I will say, what I do agree with you on, Paulette, is about going to the CDC's website and reading things for yourself. Okay? I do. And I really want the audience to do the same, to find your information from reputable sites. And in my opinion, cdc.gov is a fantastic place for you to get your information. So Crystal and Paulette, thank you for sharing your experiences, because I have learned. I appreciate it.
Yeah, and I think you're right, Paulette, also, as we close out this segment, that we have to listen to each other and not just stay in our silos and listen to only one piece. I have researched and read a lot of the other side. It's part of what I needed to do for my own edification, just to understand, and also for putting together a show like this. I have seen those testimonials. So it's not that we have not in many cases. It's just that we have also looked not just at personal testimonials, we're also looking at research, and we're also looking at what we're seeing on a daily basis. And we've heard testimonials from people who have not had the vaccine and had lost a family member who hadn't had the vaccine. We lost a coworker in our department just this week who was not vaccinated and about to get vaccinated, and he died. And we could tell you many, many stories, if you want to talk about testimonials, of people who have died because they haven't had the vaccine, or had terrible outcomes because they haven't had the vaccine. And yet, in our own personal experience as working healthcare workers, practicing every day since the pandemic started, there are very few testimonials or stories that we've seen about people dying from the vaccine. It doesn't mean that they don't. Every medication, every treatment has side effects and sometimes has bad outcomes. That's true. But for all the stories that you may read about somebody who might have had a bad effect from the vaccine, I can multiply that by the hundreds to thousands who have had bad outcomes from COVID itself. And I think it's just important to keep that in mind when we think about that. We got to listen to each other more. And that's why I'm so happy that you all were willing to come on in this setting and really talk about how you feel about masks and the vaccine and your reservations and what is driving, your viewpoints. Because as you mentioned, there are many people who share exactly your viewpoints. And we respect that there are differences, and we need to talk about those differences. But in the end, as healthcare providers, we're going to always favor facts over feelings, because we recognize we come from different backgrounds and feelings can vary. But facts and evidence is important, because that doesn't really vary that much. So thank you both for coming. I appreciate your viewpoints. I'm sorry.
I hope that the long-term effects of this don't affect any of you, and I really do, because
thank you.
I don't wish ill on anybody. And I just hope that we all want the same thing. We want everybody a healthy community. But I just don't want this to go on forever.
For sure. For sure.
And I don't feel like that we can say that it's just not realistic to think that every single person is going to get vaccinated and then it's just going to mysteriously go away, because we know that I know a lot of people that have been vaccinated and are still transmitting it, wearing masks, and they're still transmitting it and they're still getting it. or I don't know if they're, I mean, I don't feel like any of us know where it comes from, truly. We don't. So I don't know if they're transmitting it or if they're getting it, but I know they're getting it even after they've had the vaccine. And I know you can say it's a milder case, and nobody has a crystal ball. We don't know. There's a bunch of what ifs about all this.
Sure, you're right. There's a bunch of what ifs, even in medical science, and that's why we in medicine and science like to study it. We don't like to just base it on what we think, feel, see on the real time. We have to look at the larger question, and you've raised a lot of great questions. Thank you both.
I feel like it's never settled. Science is never settled. There's always questions to be asked, and you always got to be willing to listen to the questions.
That is absolutely true. Absolutely true. Thank you so much for joining us on When Docs Talk.
Thank you.
Bye-bye.
Good night.
Thank you.
That was very.
So actually, that's a very good transmission segue to our last topic that we're going to discuss is the battle against science in healthcare, because a lot of our healthcare workers feel like what was good enough for years as healthcare heroes is now under attack. I'm going to bring on all of our healthcare workers here, and we're going to talk a little bit about the war against medicine and science, because it's tough to be battling COVID inside the hospital and also feel like you're battling misinformation about COVID. You're battling people questioning whether you're lying about what you're seeing. One of our guests mentioned, we see that Louisiana hospitals are full right before the storm hit. And she mentioned that somebody went into a waiting room and it was empty, in the ER. Okay. And so that almost makes it seem as if we are trying to lie about it. And I just want to get your input a little bit about this war on medical science.
I find it it's heartbreaking. Mm-hmm. It's heartbreaking to train so hard and train so long and take care of patients so long and get to this place where you almost feel like you have to, yes, definitely explain things to everyone, but almost feeling like you have to sometimes defend science and defending medicine. Right. So I find it's tough, it's heartbreaking, but it's not going to stop me from doing, what needs to be done.
I hear what you're saying. They actually mentioned heartbreaking, and they actually did a poll. The Kaiser Family Foundation did a poll of healthcare workers. And this is since the start of the pandemic. This was over 1,000 healthcare workers. And 6 in 10 of them, 60% say their mental health suffered from coronavirus. Which I think is a huge, huge percentage. They said that COVID-19 has had a negative impact on their mental health. And some of the things that they cited is not just the disease and worrying about it and worrying about whether they're going to bring it home to their families, but also this evolution. In the beginning of the pandemic, we were all confused, a little bit scared, but we had a little bit of energy because we had the support of people. How many of you were called a healthcare hero back in 2020? We were seen as heroes. People appreciated the fact that we were on the front lines risking our lives with this disease that we were all struggling to understand. And we watched as some of our colleagues got sick and were put in the hospital. And now it's evolved into, you all are lying. You don't really know what's best. You're exaggerating. You're forcing us to live in fear. You have somebody like Dr. Fauci, who's like an 80-year-old physician and epidemiologist, well-respected in the community, in the medical community, who is receiving death threats and, is being seen as the person who's destroying our country because he, along with other healthcare providers, are trying to find a way to slow the spread of this terrible disease. And it's disheartening. Tell me about some of your feelings in terms of whether you felt attacked, whether you feel like there's a hidden war on healthcare.
I feel like everyone has an opinion, but everyone on this panel right now knows what it's like to be on the front lines. We were scared last year. I mean, still scared, but it was really, really scary last year when I personally didn't know if I was going to bring this home to my 76-year-old mother. I had major concerns about that. And to have to deal with that, now to deal with us being the villains, I don't get that.
I mean, last year we were frankly accused of making money off of COVID. And if you go to some of these websites that I believe Paulette was referencing, because some of my friends, they don't, because they're like, I'm protecting my mental peace. I don't want to, feel stressed out, but I really want to know. Bring it. I want to hear what's being said. And the truth of the matter is there are websites that describe physicians today as greedy, that we want to promote COVID fear because it's lining our pockets. The former president of the United States openly got on television and said that physicians make money when people get COVID. And so to hear that when you're risking your life every day and working in these overcrowded emergency departments and hospital rooms for our hospitalists is very disheartening.
I think one of the things is so frustrating because everyone's an expert on your field. Like everyone comes in and they're like Dr. Google, they've done all this research. And you're like, did you go to medical school? And you just read that on the internet and you're going to tell me that this treatment is going to work better? That is really, I think, frustrating. It's like me going to the mechanic and saying, hey, I know how to fix cars. Or, I'm going to the contractor and say, I know how to build a house. I don't know how to do those things. I cannot read on the internet and figure out how to build a house.
Thank you.
And I think that is something that really frustrates me.
And what's funny is they're coming to you. So that means on some level, they recognize that you are an expert.
Exactly.
So it's one thing if you say, I don't trust medical science. I know how to do it better. I have my own protocols and my own mechanisms. But then you stay at home and do those. Instead, you're still coming in. And I'm not one of those physicians who has developed compassion fatigue. I know there's a lot of physicians who are like, no more. If you're not vaccinated, if you're not doing the right thing, I can't deal with you. I'm not there. But I definitely understand how frustrating it is for somebody to come in and tell you how to do your job when they have no idea in many instances. And yet they still demand that you treat them. It's like you gotta have to pick and choose. Like, do you want us to give you our expertise and treat you? Or do you not trust us? It's very hard for us to navigate.
I had a colleague the other day who they had a daughter who they were concerned about having a stroke. So she got a CT scan, which is for those who don't know a lot about healthcare, it's a lot of radiation. And then she got another specialized CT scan. And then the child was transferred and they learned that the child actually had a fever and some other symptoms that actually sounded like COVID. So my colleague walked in the room all excited to say, hey, your daughter didn't have a stroke and she's doing fine. And the mother shared about all the fever type symptoms. She's like, oh, your daughter could have COVID. Let me do a COVID test. And the mom said, you know what? I heard that COVID test can cause you to have breast cancer. And my colleague is aback because, of course, all physicians and nursing and people know that actually CT scans have a lot of radiation. That actually was the risky part, not the cotton swab that you can buy for the store. So I think those are the things that I think we're combating some of this misinformation.
Yeah.
It's too much social media misinformation that I think is really challenging because you're like, where did you get this from?
Absolutely.
And you probably got this information at 4 a.m. and she was like, I can't even deal. It's 4 a.m.
No. And then you don't want to seem like you're trying to condescend because honestly, I do believe it's important for us to educate our patients and also form care partnerships, because I do want people to be involved in their healthcare plan. It's not just me telling you, this is what you need to do. You do this. It's like, okay, let's share this decision. I'm going to give you all the facts and all the things you need to make an informed decision. This is what I highly recommend, but it's hard because you don't want, like when you say you don't know how to do my job, then you meet people thinking that, you're trying to condescend them. And it's a tough fence to straddle. In fact, the commissioner of public health, the Department of Public Health, the Georgia Department of Public Health specifically, she was doing an interview and she said, her name is Dr. Kathleen Toomey, and she was saying that we are not valued. We're ridiculed. We're lambasted in social media. This is absolutely unprecedented in my public health experience. So this is somebody who's at the top of the chain of command when it comes to public health, where I really think there is a backlash against expressing her frustrations. We have a viewer who's talking about the doctors pushing for big pharma. That's another thing. We're accused of pushing medications. It's so funny because I don't know about the rest of you, but I'm a medication minimalist. I really don't like people to be taking medicines unless they absolutely have to. And some of the same patients that that are saying that big pharma is influencing doctors will be the first in line to ask for antibiotics for a simple cold, which is not the treatment for a cold.
But there's actually a lot of rules in healthcare about actually preventing doctors from actually pushing big pharma. There's like the Stark rule and all those kind of things that actually really do protect patients. So that actually really isn't true at all. And there's many facilities don't even allow drug reps in their facility to begin with. So I think it's actually a lot of misconceptions out there that unfortunately that people are propagating.
And it's interesting because, I was just going to say though, it's interesting because they are angry, like they come in wanting the drugs that they want though, you know, from the standpoint of, you know, just like we're saying, we're discouraging people with antibiotics, but I mean, you know, I haven't had it personally, but I mean, I've had colleagues where patients were asking for ivermectin, for prescriptions for that. You know, and that's the thing. It's like, well, how do you choose that that's okay versus these other things that we're saying that are actually proven to be good for you and okay and will help you? So that's the thing. It's like they are very, very picky, or like it's just interesting how they choose their argument from the standpoint. Okay, y'all are pushing big pharma, but I want my you know, Regeneron.
Right. Right. I know both Morgan and Yolanda want to say something. I hope one of you will address our comment that's up from one of our viewers. And you're on mute, Morgan.
I'm not. Am I?
Oh, yeah. No, you're not. Sorry.
Okay. I'm reading this comment. Hysterical women.
Thank you, Gloria.
Thank you, Gloria.
I think she means we're funny.
I don't see where any of us have been hysterical. We've just been stating the facts.
I mean, the definition of hysteria is something that's affected by uncontrolled or extreme emotion.
Thanks,
I know
Dr.
I
Lee.
can act a fool. I have not.
Correct.
And I don't believe anybody else up here has acted a fool. But as far as reading the vaccine inserts, you know, when I was getting my vaccine in that 15-minute time period afterwards, I did not read it from start to finish. I would like to know if she did.
I've actually read the studies in full, which has a lot more information than the vaccine insert. So if you have a particular question about something in the insert, I can try to address it.
Thank you, Dr. Megan.
Yes,
thank you so much.
And that's the thing that, you know, we have people like you and several other doctors who literally are involved in these studies and can tell you the ins and outs, like the mechanic of a car. They actually design the car in a way, like, so it's not just mechanic, they really know how they run, but those are the very ones that a lot of times patients are not interested in hearing from. But that's not all. There are several patients who are interested. Morgan, you were going to say something. Jump in.
This is just an example of the negativity that we receive. I think that we allowed our guests to speak their opinion. I think we were respectful of that. I think that, you know, we all maintained our composure. I don't think anyone got really excited and upset. I mean, this is just an example of the hostility that we receive as healthcare workers and people who are proponents for the vaccine and for masking. This is just I'm glad this is up there because this is just an example of it. It's sad.
Yeah, I agree.
Something that I think, or at least I found really, really helpful is our patients are coming to us and asking us about these things. And I think a lot of times it's because they really want to hear our personal experience of something that I've found is instead of, you know, kind of talking about, you know, the effectiveness and giving percentages, et cetera, is that patient who is hesitant and who's concerned. What I say is, I understand. I have an aunt who felt the same way. And it took, you know, a few months for her to, you know, decide that this is what she wanted. So I just kind of hope that all of us, and I know that all of us are, you know, sometimes stepping back from the data. We know the data. We can, you know, quote this left and right, but our patients need to hear from us, especially us, all of us are Black women, with respect to our personal experiences, what our families have felt. You know, I appreciate one of us saying, hey, early on, I even had some hesitation and some questions, and that's okay to have those questions. But what we have to do is be respectful of each other. Yes. And you know, respectful of everyone's opinion, and, you know, to just do our absolute best to take care of each other. It is my responsibility as a physician to take good care of patients and my loved ones. what I would really hope from the community, and we are a community, is that, we're offered that same kind of, respect, and for, people to listen to us and, not call us out of our names, et cetera. Let's be civil and kind to one another.
And I blocked that user, that person who put the comment on, because she started to get really disrespectful and mean. But that's just an example of what we deal with every day.
Every day. Actually, if you don't mind taking down the comment, you're right. We deal with, and it's not just us. It's not just medical people. Go ahead and pull that comment down for us, Morgan.
Yeah, I am.
You have comics like this. The TV told us we're all sick, so the media and the people who report on healthcare data are targeted as giving false information and trying to make everyone feel sick. You have people saying, that there are no lives saved by the mask, the test, and the vaccines. Of course, I don't know if any of you have been called sheep, but I've had other patients, not even healthcare workers, been called sheep for wearing masks. If you can recall the video we showed in the beginning of this segment with the ladies coughing on other people in a grocery store, she was calling those other ones sheep because they were wearing masks in accordance to the mask mandates. So this is something that really is a problem. It's not just COVID. It's really trying to find common ground, how we can have discussions, because in the end, I think we all want to get back to normal life. I think we just disagree on how we're going to do that and what's the most effective pathway. And there are also some people who have insisted that despite the fires that we're seeing, the fire that is metaphorically COVID, they're going to act like this is normal life and that, there's nothing wrong, nothing to see here. I want to thank our expert guest for coming. We really appreciate your input, your insight. Those of you who are returning, we thank you so much. I can't say enough about how proud I am that we have experts that we can talk to about this in infectious disease, in anesthesiology, critical care, and also somebody who was heavily involved with research. And I think it's important that we keep our voices loud, respectful, but loud, because there's a lot of work that we have to do. Even though we're tired, unfortunately, there's no rest. Exactly. No rest for us in sight. Thank you all for joining us. We're going to have our WDT crew give us some final words.
Continue to mask up, people. It works.
All right. So Morgan, that's your word. What's your final thoughts, final prescriptions for our patients and our viewers?
Yeah. Well, I'm just going to say, I still feel like, it was interesting because, I don't know, I feel like certain people co-opt the concept of being American. And we're all American. And just even as a veteran, we're all Americans, and we all want the same thing. We all want to be healthy. We want our communities to be healthy, our loved ones to be healthy. And so definitely, I'm not going to say, we all have differences, but at the end of the day, why can't we give each other enough grace to have those differences and discuss it and talk? The anger, the meanness, the vitriol, it's too much. It's too much. And so I just pray that through the remaining time, and we don't know how this is all going to end, but I'm praying that at some point we can all come together truly as Americans and try to come to a common ground and a common solution.
I hear that. Davida?
I think I know and I share the frustration with a lot of people. Everybody is over COVID. I understand. I see it every day. I deal with it in my job, in my family, on a daily basis. I understand. Willing it away is not going to actually get rid of it. Just pretending that it doesn't exist isn't going to get rid of it. There are certain things that you have as an American. Let's use that term. Yes. It's so popular today. As an American, you have a responsibility to do certain things to protect the public. Okay? So if you don't want to get vaccines or mask up, stay at home, self-isolate. Practice proper hand hygiene. Maintain 6 feet, okay? I'm not saying that what I do, my personal choice to vaccinate, my personal choice to not go anywhere without a mask, because I don't want to be in the house all the time. I understand nobody wants to be in these four walls 24/7. So if I make the decision to leave my home, there are certain things that I'm responsible for to ensure that I'm not putting others at risk. I think that until everyone accepts their responsibility, we're going to continue to deal with COVID. It's just not going to go away because we will it so. Okay. So I understand they're retired, but we still have a lot of work to do.
I agree. Thanks, Davida.
Yeah.
Dr. Yuli.
Thank you, Donna.
And thank you, Donna, yes, for that comment.
Yes,
Dr. Yuli.
I do appreciate that, Donna. I am carrying a life inside of me, and I have been dealing with COVID on the front lines since January, since I found out I was pregnant. And I have been dealing with everything from people who have been willing to mask up, to social distance, to get vaccinated, to those people who come on here and calls us charlatans, witches, and whatever word they found on Google this evening. That being said, I trust science, and I've gotten my booster shot, meaning I've gotten a third vaccination. I have that much faith in what I have studied. That being said, I just want people to take care of themselves and to respect the way that others are taking care of themselves. I do not feel that anyone's choice to wear or not wear a mask should evoke violence, anyone losing their life, or anything like that. And if you think that there is some kind of way that you not wearing a mask or not getting vaccinated means that you can then put your hands on somebody else, that's something that you and your deity need to have a conversation about, because I'm pretty sure you can't try any of us like that, and I pray that you haven't tried anybody else like that.
Completely agree. We stand divided on so many things in this country, in this world for that matter, but certainly in this country. We all love this country. I love this country. I was born here. I was raised here. My parents came here to this country years ago, before I was even born, and they loved this country. And what they loved in this country is that there were so many different people who didn't sound the same, didn't look the same, didn't necessarily live in the same kind of houses, just different. And yet we could all come together when it came to important issues that mattered. And what saddens me the most about COVID and the COVID cultural wars, as we call them, is that is slowly unraveling. That tight fabric in our society, which knitted us together, even though we don't agree on so many things and we can squabble about this and that. But when it came to something that affected us all as Americans, we wanted to do what was right for our country and for our brothers and sisters. There have always been people who are more self-absorbed than others. But in general, I feel that America is an altruistic nation. We have helped other people in times of need. If there's a crisis, we've always done that. COVID-19, whether you like it or not, whether you want to agree, whether you want to be in denial, is an evolving crisis in our country. In such a short period of time, there are too many people dead, sick, or in some ways disabled when you factor in long COVID. We don't have to live this way anymore. There are things that we can do that have been studied. Not I tried this cocktail, not I saw a few studies on this medication that I wanted to try, but that we as a medical community and as a society have studied rigorously. And we've offered them, and some of them are not even medications. Some of them are as simple as a mask. In schools that are debating whether children should wear masks, I say that when the numbers come down and it's safe for our children to go in without a mask, I will be the first one to throw off my mask. But until then, I don't believe that my personal choice or anyone else's personal choice should put even one child in the hospital, at home sick for days, or with the possible repercussions of a sick parent or loved one, not even one child. That's my belief. But beyond it being my belief, I know that your rights end when they encroach upon mine. We all have personal rights to our body and our choices. And I don't want to force anybody to do anything. I support the vaccine. I'm on the fence about mandates, to be honest. But I definitely know that we need to do something to tighten that fabric in our society that made us band together when we had something killing hundreds and thousands of Americans. I don't know how we're going to get there, but I think talking about it is a start. So I think my take-home message is going to be mask up. It works. If you are taking care of kids in a school as a school administrator, that should be your priority. Don't play Russian roulette with these children's health or their lives. Strongly consider the vaccine. It is very effective and very safe. And that, even more so than masking, can help. And while we're dealing with this, take care of yourselves and be kind to each other, because it's not going away anytime soon. We have to learn to live with it safely without killing each other in the process, just arguing about things. Thank you for joining us at When Docs Talk. We hope that somehow, some way, something's come out that has enriched your life or given you a new perspective. And we hope that you will join us next time. Thanks.
Bye.